Have you ever woken up with an unwelcome surprise in your nose, a scab? Small, crusty scabs in the nose are a common occurrence, and while they can be annoying, they're usually not a cause for serious concern. However, if you're experiencing persistent scabbing or other concerning symptoms, it's a good idea to consult a healthcare professional. First, let's see the trouble with scabs in your nose. Scabs in the nose can be more than just a minor inconvenience. They can cause pain or discomfort, especially when picking or blowing your nose. Dryness and irritation. Scabs can disrupt the natural moisture balance in your nose. Bleeding. Picking at scabs can irritate the delicate nasal lining and trigger nosebleeds. What causes those pesky scabs? The culprit behind your nasal scabs can vary. Here are some common causes. Dry air. Dry winter weather or indoor heating can zap moisture from your nasal passages, making them more susceptible to irritation and cracking. Allergies. Seasonal allergies or irritants like dust or pet dander can trigger inflammation and lead to scabbing. Overzealous nose blowing. Blowing your nose too forcefully can irritate the nasal lining and cause small blood vessels to burst, forming scabs as they heal. Habitual nose picking. Picking your nose can introduce bacteria and disrupt the natural healing process, worsening scabs. Overuse of nasal sprays. Certain decongestant nasal sprays, if used for too long, can dry out the nasal passages and contribute to scabbing. Minor injuries. A bump or other injury to the nose can break the skin and lead to scab formation. Underlying conditions. In rare cases, scabs in the nose may be a symptom of an underlying condition such as nasal trauma, herpes, sinusitis or nasal vestibulitis. More dangerously, it is a symptom of HIV or nasal cancer. Soothing the scabs, effective treatments and preventative measures. The good news is that most nasal scabs can be easily treated at home. Here are some tips to promote healing and prevent future scabs. Increase humidity. Use a humidifier to add moisture to the air, especially at night. Saline nasal spray. Gently mist your nasal passages with saline spray to loosen scabs and soothe irritation. Warm compresses. Apply a warm compress to your nose for a few minutes at a time to increase blood flow and promote healing. Petroleum jelly. Apply a thin layer of petroleum jelly to the rim of your nostrils to prevent dryness and cracking. Keep your hands off. Resist the urge to pick your nose. This can worsen irritation and prolong healing. Treat allergies. If allergies are the culprit, consult your doctor about allergy medications. Hydrate. Drink plenty of fluids to stay hydrated from the inside out. If your nasal scabs are extremely painful, accompanied by significant bleeding, not improving with home treatment, associated with other concerning symptoms, fever, facial pain, etc., seek medical attention from a healthcare professional. Early diagnosis and treatment can help address any underlying conditions and promote healing. Thanks for joining us on the Info channel. We hope this information has been helpful. If you have any further questions or would like to share your experiences, please don't hesitate to leave a comment below.